Back here at home right now, a warning from the State Department of Public Health. There's been a rise in whooping cough cases. So far, the number of cases this year in our state are nearly 10 times higher than the total in 2023. That's especially concerning because most Connecticut kids have not gone back to school yet. So what should parents know before sending the kids back to school? Well, tonight we're joined by the Stratford Health Department. Here we are. Hi, this is Andrea Boissevain. Thank you for joining us.
Hi, thanks for having me.
So how alarming are these numbers for us? How closely are you monitoring the spread?
Oh, well, we definitely have our eyes on the state data that's coming in. So yeah, we definitely have wanting to look at all the cases. We haven't seen anything here in Stratford, but certainly in the region we're got our ears and eyes open.
So who's most at risk for whooping cough? Who's most vulnerable?
The most vulnerable are going to be your infants, less than 6 months old, and those that have only had one or two of the vaccines, because they're just certainly infants aren't vaccinated at all prior to 6 months.
And for an infant,
pregnant women as well.
Okay, so for an infant, right, what sort of symptoms are we looking out for?
So they start off with sort of a mild cough. It seems, low-grade fever, runny or stuffy nose, a mild occasional cough. But then there are various phases to the vaccine. To the illness, and then it develops into a pretty significant cough. And infants can sometimes just present with not breathing at all. It's called apnea, and that's really scary for parents.
Absolutely. So would potentially they be hospitalized over whooping cough?
Yes, they could.
Okay. I think ever since the pandemic, we've come to have a basic understanding, of how germs spread and how to keep yourself healthy. So what can you tell us about whooping cough and how contagious it is? How does it spread?
Whooping cough is very contagious. Symptoms can begin between 3 and 12 days of being exposed and can last up to 2 weeks. Actually, coughs could probably last much longer. And the coughing can be violent and rapid, where it's very difficult to, gain air into the lungs. It can have that sort of whooping sound.
Hence the name,
again,
right? So
hence, yes.
Yeah. So if you have an infant at home, would you recommend staying home right now? Like, how do we protect our babies?
Certainly, yeah. So we for any respiratory illness, we encourage, if you're sick, stay home, and if you have those symptoms with your small child, definitely call your healthcare provider.
Let's talk about the vaccine now, because we might have heard of this vaccine, right? I know when I was pregnant, they talk about this vaccine extensively. Mm-hmm. It's the Tdap vaccine. So how often should we be getting it if you're not an infant or you're not in one of those vulnerable groups, and who should be getting the shot?
So this has actually a fairly lengthy vaccine schedule. So the vaccine, you should be getting it at 2 months, 4 months, 6 months, 15 to 18 months old, and to 6 years old, and then 11 to 12 years old.
So this is something that we should probably contact our doctor to see if we're up to date on our shots.
Absolutely. Contact your healthcare provider. We've got this great campaign here in the region, in the Fairfield County region, where it's called GetVaccinated.ct.org, where we provide a list of the vaccine schedules for all kinds of vaccines for childhood immunization, but also we let people know where vaccines are. You can get them either from your physician, or you can even go to local health departments. So we definitely offer those. In fact, here in Stratford, because we're back to school, we're offering back to school clinics with physicals and vaccines, but our several of the local health departments in the area have combined forces and are sort of promoting this the campaign Get Vaccinated, CT.org.
Yeah, and crossing our fingers that we don't have a severe outbreak of anything this flu cold season. All right, thank you so much, Andrea. We appreciate your time.
Thanks. Yep.